What to expect when your doctor is going to do an observation or a testing for autism. As many of you know and have experienced in my practice, I see families for multiple visits. And on the third visit is when I administer a tool to diagnose autism. I usually use Autism Diagnostic Observation Schedule. What can you expect on this visit when I am administering the ADOS? Here is a little video that shows how the room is set up. So you can see there is a table with 2 chairs, and I am sitting on one side and the child's on the other side. The parents are allowed to observe, and they sit a little further back in 2 comfortable leather rotating chairs. The items on the table are used to engage the child, and depending on their age, there may be different items used. In this example, for a child in preschool to early school years, I have my form, which I will take notes on. I also have a remote control device to activate toys. This is to see if a child can find a toy only using my eye gaze, or do they need help by me activating the toy into movement. There are also some items that can be lined up. There are toys that have texture, such as sandpaper, fabric, and yarn. Then we have games, little games, handheld games. We also have scenario items for social engagement. A very important social interaction takes place at birthday parties or at the dinner table. So you can see the birthday cake and some plastic dishes. Also used in the observation are items to see how the child anticipates routine when using certain objects. For example, there is a box of tools, and there is a baby doll with some bathing items. I will note if the child uses the tools appropriately. I also can comment on their fine motor and gross motor movements. In the case of the baby doll, a brush and sponge are observed to be used appropriately. All of these tools are used to identify certain areas of deficiency in 2 major categories involved in diagnosing autism. The first category is social skill, and the second category is repetitive restrictive actions. The observation includes anywhere from 10 to 15 observable and coding experiences. And some examples are response to name, bubble play, response to social smile, receiving a snack, functional and symbolic imitation, and response to joint attention. It's always fun for me, and usually it's fun for the children. It's also why it is important for me to see them several times before this experience to ensure maximum participation and to give them the greatest opportunity to score their very best. So if you have more questions about autism testing, feel free to contact me.